This is a paper from the Annals of Internal Medicine from some time ago, which showed that about 1/3 of people with SARS-CoV-2 infection never develop symptoms. That's the good news. Next slide. Of those who do develop symptoms, about 80% have mild to moderate symptoms, but about 20% or more have severe disease, with case fatality rates varying from a few percent to up to 20% for those requiring mechanical ventilation. Now, let me show you something that is very dramatic. If you look at the multi-system manifestations of COVID-19, they are multitudinous. The most important and common of which is the acute respiratory distress syndrome. But we know now there are neurological disorders, cardiac dysfunction, acute kidney injury, hypercoagulability. Bottom line, this is a very serious disease, which has already led to the death of about 550,000 people in the United States. Next slide. This slide is very dramatic. If you look on the left-hand part of the slide, it's a normal CT scan of the lung. The area that looks black and dark are normal lung because there are air spaces. On the right-hand side of the slide is a patient that I made rounds on at the NIH Clinical Center last week. If you look at this, even a non-physician, non-radiologist can determine that there's something very, very wrong with the lungs on the right-hand side, with the white blotches being infiltration of the lung, that even with the patient being under the top medical care that we're giving them at our hospital, still may very likely have residual scarring of the lung after improvement. Next slide. This is another patient we saw at the clinical center who developed a brain infarct, as shown on the left-hand part of the slide, with the arrow pointing to the infarcted part of the brain. Bottom line, as Dr. Walensky said in her experience at Mass General, the same at the NIH Clinical Center, this is a very, very bad disease. The fundamentals to prevent acquiring this are the public health measures that Dr. Walensky mentioned, but also vaccination. Absolutely critical. Next slide. If you look at the prevention of hospitalization and death among the 5 vaccines on the left-hand part of the slide, with one exception of a hospitalized patient in the vaccine arm of the Moderna study, virtually 100% protection against hospitalizations and death. In other words, we can prevent what I showed you on the previous 2 slides by getting vaccinated. And on the last slide, what you see in red is hospitalizations going down, as in the blue bars, vaccinating people going up. The bottom line, hang in there, as Dr. Walensky said. We really need to hold on to the public health measures as we get more and more people, from 2 to 3+ million people, vaccinated every day. It will be a race between the vaccine and what's going on with the dynamics of the outbreak, and we can win this by just hanging in there a bit longer. Back to you.